Okay, good morning everybody. Welcome to the Association for Mental Health Providers webinar. This is our 6th webinar. We've had a whole series of exciting discussions over the last few months, and this is our last one until September now. My name's Kerry Bamber and I'm the Policy and Membership Lead for the Association for Mental Health Providers. And I'm delighted to have with me this morning, not actually in the same room, Sarah and Emma from the National Survivor User Network, who are going to be talking about the Service Users Manifesto for Mental Health. So I think, Emma and Sarah, if you're both still there, are you both still there?
Yes, yeah.
Fantastic. I think it's time I muted myself and handed over to you. So I'm going to manage the slides. So if you just say to me when you want the slides to change, and I know you're going to be moving between conversation between you. So I'm just thinking if you give me a cue on who's going to speak, I will. Actually, it's not too noisy, so I think we can keep you both unmuted, so you can just have a conversation and pass between you, and I'll mute myself. So over to you both. Thank you very much.
Thanks, Carrie. Thanks so much. So yes, yeah, it's great to be here and have the opportunity to talk about our members' manifesto. My name's Sarah Yiannoullou, and I'm the Managing Director of NSUN. And my colleague is. Do you want to introduce yourself, Emma?
Yes, I will. Yeah, I'm Emma Ormerod. I'm the Research Manager at NSUN.
Wonderful. So, next slide, Carrie, which just gives us an overview of the webinar today. So, starting with introductions, so we've just introduced ourselves, and then we want to introduce the National Survivor User Network to you, just tell you a little bit about the organisation. Then Emma will go through the methodology, how we gathered and analysed the views and experiences of NSUN members, and then just to go through the summary points before we go through the manifesto points in a bit more detail, telling you about some of the work that we're doing to progress the manifesto points. And then we will finish with questions. And also, it'll probably be good for you to think about what manifesto points are most relevant to you and of interest to you or your organisation. So, next slide, please. So, NSUN, we're a user-led network across England, and we promote and support the independent, collective and direct voice of people with lived experience of distress, disadvantage and discrimination. So we have a vision, and the vision is of a diverse, inclusive and influential user-led network with the strength to challenge inequality and improve lives. And our mission is basically to create that network, one which will engage and support the wide diversity of service users and survivors across England. And the three overarching aims are really to create networks of individuals and groups, strengthen service user-led groups, and to influence and inform policymakers and planners. And we do that in a variety of ways. We have lots of initiatives and projects, and we're going to talk a little bit more about that later on, and the graphic there is a graphic recording of our AGM in 2015 and the soapboxes, which members have space and time to talk about all their aspirations and issues at our members event each year. Next slide please, Carrie. So just a bit about our history and where we came from. Back in 2003, some of you may know about the On Our Own Terms report. On Our Own Terms was a report following a study that was commissioned by the Centre for Mental Health about the mental health service user movement in England. It concluded that in order for the movement to reach out to greater numbers of service users and survivors and to have substantial influence on policy and provision, there needed to be a strategy that was based on collaboration between service user survivor movement, the government, health and social care services, and the voluntary sector organisations. And the strategy needed to have particular aims around building the capacity of the movement, strengthening and developing user involvement nationally and locally, and also to develop a new integrated prevention, self-management, recovery and inclusion focus for all services. I think in looking back at those aims, we can see that a lot has happened since 2003, and now of course peer support, recovery, co-production, the language of all of those things is now commonplace. But there's still quite a noticeable gap in our experience between rhetoric and reality, and the members' manifesto aims to address this gap. What this study provided was a really strong evidence base for further work and subsequent funding to develop a national network. So in 2006 there was a conference in Birmingham called Our Future Conference, and that sought to obtain a mandate, if you like, from service user activists, people who use services and identified with having experience of mental health issues and service use. And following that conference, a number of people came together to look at how to progress the work and pull together some funding applications. So in 2007, that's when NSUN received its first grant, which was a partnership arrangement with Comic Relief and Tudor Trust, and that was for 5 years. One of the conditions of that initial funding was to be hosted. So we were initially hosted by Together Wellbeing for Mental Health, and then worked on building the network over the next couple of years. 2010, NSUN became an independent charitable company, held its first AGM the following year, and then obtained some further funding. Carrie, you can change to the next slide now. Just to say as well, in 2009, NSUN had just over 200 members. Now we have over 4,500 members. That includes individuals and groups. And we have an estimated reach probably of around 10,000 through social media and other activities. Since 2009, we've been involved in lots of different activities, ranging from being involved in consultations and studies and research, but also leading consultations, studies and research and focus groups around particular pieces of work. Oh, something's just come up on the screen, sorry, Carrie. Also facilitating and organising events, delivering training, particularly leadership training around the country. I think we've delivered 9 leadership programmes now. But also supporting other user-led initiatives, and not just in health and social care, but also within the arts and other interest areas as well. And all of these activities aim to collate the views and experiences of people in a way that we can then communicate them in an unbiased and unfiltered way, but also in order to challenge what historically we've experienced as our experiences being dismissed as anecdotal or irrelevant. So communicating them in a more sophisticated way and in a way that really brings together the collective issues and experiences is what the manifesto seeks to do. Next slide, please. So Emma, I'm going to hand over to you now, and Emma's going to just talk to you about the theoretical framework and methodology that we've used to develop the manifesto.
Lovely, thank you, Sarah. Yeah, so before I start talking specifically about the development of the manifesto, I just want to give a little bit of background to the framework and to the methodology that underpins all of the research work that we do. So part of our internal evaluation activity, that obviously relies on using traditional quantitative measurements like membership numbers, number of people attending events and activities, but we also want to carry out really good, robust, qualitative research. And if you're familiar with qualitative research, with those methodologies, you'll know that it can generate really rich, detailed, contextual data. It foregrounds views, beliefs, experiences of service users and survivors, and really kind of captures that range of voices. And I think that really connects with our vision of strengthening the collective service user voice by connecting people, sharing experiences in order then to shape mental health policy and services. So looking at our theoretical framework then, so we draw on the philosophical approach that's known as post-structuralism. Now, if you've never heard of post-structuralism before, don't panic. I'll just give you a really brief introduction to it. So post-structuralism, it arose during the mid-20th century as a response to the structuralist intellectual movement. So structuralist theorists, they took a really scientific approach to language, and then that was criticised for its rigidity, for its failure to acknowledge really the importance of different historical and cultural contexts. So the proponents of post-structuralism, they took the position that reality is socially constructed through language. So there are lots of different truths out there, and that's depending on your context, on your experiences, and from different perspectives. Now, this approach has been used a lot traditionally in literary theory and cultural studies, so for the analysis of texts. And I think if you've ever read the work of post-structuralist theorists, you'll possibly find that can be quite a confusing, quite a frustrating experience. I certainly do very often, because it can be really difficult to understand. And something that I've personally been interested in over the years is how can we apply these ideas about language to contexts outside of academia, to mental health contexts. And I think that it is applicable. It can be applied to sort of real world contexts, because it really questions forms of knowledge that we might take for granted, that we might assume as being self-evidently true, or might be presented to us as being true. It draws attention to the way in which language is used as a means of creating and of maintaining power relations. So it really starts to unpick some of those ideas. It challenges mainstream perspectives that are sometimes often presented as being universal, and so it creates a space for more marginalised voices to be heard. And it encourages us to develop a greater awareness of how language shapes understanding through the creation of something called discourses. We're basically talking about statements about a particular topic. So this framework is really in keeping with that qualitative methodology I've just been speaking about, that looks at the multiple different kind of situated perspectives of research participants. So these philosophical theories, they can be complex. They might even initially appear to be quite irrelevant when we're thinking about issues in the so-called real world. But I think they can really encourage us to question our beliefs and our practices, and ultimately help us to challenge the status quo. So if we can move on to the next slide, please. That's great, thank you. So this framework then, that really informs our practical approach to conducting research at NSUN, and the decisions that we make about that. So very briefly, in terms of the process of analysis, broadly speaking, when we're doing that qualitative analysis, we're identifying recurring themes, ideas, attitudes, views, and depending on the kind of work it is, it might be categorised or indexed. But something like our member survey, data is often structured around the questions, but then we make links between categories when particular themes are noticed. So it might be comments about mental health act, for example, and so we will group those together and then think about the different experiences or the different perspectives within that. And then in addition to that, in all our work, we try to pay attention to three main areas, really, that I'll just briefly go through. So the first one is an idea of reflexivity. So all of our qualitative research, our evaluation activity, it aims to highlight the importance of something called reflexivity. And so that views the researcher's identity, their involvement in, and their experience of the research as both valid but also quite problematic. But we're aiming to emphasise the importance of that open and honest and reflexive account of the research process. And then that then highlights that sort of partial nature of the data. And it acknowledges identity and experiences of researchers, what they bring to the project. So both the researcher and the research participant, they're seen as both being actively engaged in this process of producing knowledge together, really. Power, and so obviously for a lot of people, the experience of receiving a psychiatric diagnosis, of being on the receiving end of mental health services, that can really often lead to a loss of voice, agency, and the right to self-representation. So when we're doing our research, we really want to pay attention to those shifting power dynamics operating within different research settings, within different contexts. So, for example, between clinicians, managers, service users involved in a project, for example. And then the third area, that's about validity and reliability. Now, there's often been a lot of discussion around this in qualitative research circles about the extent to which these traditional quantitative methods of validity and reliability, you know, what is good quality research, how they can be adopted in qualitative research, because obviously, you know, we may not have the numbers. There's more interview data, there are more words, but fewer people might be interviewed. So, you know, how do you get good quality, robust data from that? And Norman Denzin has noted that objectivity or evidence, they're political, they're ethical terms as well. So he says it's important to conceptualise inquiry within a moral frame. It's looking at principles and values as well. So all of our research work, we aim to uphold the principles of good practice when conducting and analysing research by taking, as I say, that really explicitly reflexive and an ethical approach. And something like Alison Faulkner's Ethics of Survivor Research would be something that would be really key in guiding our approach to that. So moving on then to the next slide. Thank you. So that gives you a bit of background about our general approach to research. Now I'm going to talk a little bit more specifically about the development of what has become the Members' Manifesto, as we call it. So first of all, it's an evolving document. So it was initially developed a couple of years ago in 2015, and then we updated it at the start of this year. So the document was developed using themes that were really clearly emerging on a regular basis from a number of different sources. So really it's been kind of task of pulling together from a lot of different places what we know. And some of the key places are our annual members survey, which captures views relating to NSUN's activity, but also in relation to people's experiences of mental health policy, practice and involvement as well. And our top 10 issues list, which we've been compiling for quite a few years now, and we ask, what is the single most important issue for you in mental health? And then we create an annual list based on responses as part of that survey. We also collated responses following a direct request to members asking what they thought should be in a manifesto. And then in addition to that, Sarah's already mentioned the soapboxes at our AGM, events, other research data that we collect. So for example, recently did a survey around people's experiences of restraint. And so bringing those different findings together and collating them has been one of the tasks of the manifesto. So why write a members manifesto, a service user manifesto? Well, we wanted to outline the key issues in mental health from the perspective of people with lived experience. And so that's what's really making it unique, I think. So it's drawing together our aspirations, intentions, our key demands with regard to mental health policy and practice. So it's not exhaustive of all issues or concerns or communities, but it does represent the priorities that have been expressed by our members. And then finally, it's a really collaborative process. So all of our key documents are written collaboratively. And actually, just to link back to the point I made about validity and reliability, obviously the more we consult, the more we work collaboratively, the more likely it is that the work we produce is a good reflection of what our members think. So each draft is sent to the wider NSUN team and the board for comments, suggestions for specific wording, especially for the summary points themselves, and for things like additional references within the document. And then a final draft of the manifesto was sent to the membership for comment. Now, obviously, working collaboratively both with a lot of data and then a lot of input from a large number of people can be really challenging, because obviously people are going to have different perspectives, different priorities, and not always agree. So it can be quite a task pulling all of that together, and also quite time-consuming. But I really think that it creates a richer final product that really reflects the views of the membership at each stage in the development of that document. So if we move on to the next slide, please. Thanks. So I'll just very briefly go through the summary points, and then I'll hand back over to Sarah, who's going to talk about a bit more detail about each of the points in turn. So the first point then, address the injustice and harm that have been caused by cuts to public funding and changes to the benefit system. So in the original version of the manifesto that appeared, but that's now risen to the #1 priority, which I think is really interesting, quite significant. People are now telling us this is a big priority. This is the #1 thing. Make the policy of getting the right support at the right time, in the right place, and from the right person a reality. Pressure mental health services to make the principle of nothing about us without us a reality at all levels, through meaningful involvement in decisions about our own individual care and genuine co-production to develop services. So at the beginning, Sarah mentioned that difference between the rhetoric and the reality. This is certainly something we see in terms of co-production at the moment, and we're really looking for genuine co-production here. Fourth point, working together with people from socially deprived and marginalised communities to determine their support and develop alternatives. And if we go to the next slide, #5, thank you. Challenge institutionalised discrimination and put equality back on the agenda for mainstream mental health services. 6, call for a reform of the Mental Health Act 2007 to make it fully compliant with human rights legislation and ensure that people are not harmed or abused. Reflect the social model of disability and promote informed choice and alternatives to medication. And then finally, reclaim, challenge and revive survivor knowledge and research. And I'm going to be talking a little bit more about that in a minute. Now I'm going to hand back over to Sarah, and who's going to talk through each of the points.
Cheers, Emma. Oh, excuse me. So, first of all, this is really just to give you a flavour of some of the work that we're doing and taking forward to address each of the manifesto points. So, addressing the injustice and harm that have been caused by cuts to public funding and the changes to the benefit system. So what can we do? Although we're a national organisation, we are a fairly small and limited organisation and team, but working with others really does extend our reach and increases our capacity. So working with other groups that some of which are kind of single issue organisations and collectives of activists. So working with organisations, and sorry about the abbreviations here, but social workers and service users against austerity, mental health resistance network, DPAC, and Recovery in the Bin. They're all organisations that particularly aim to challenge some of these injustices and are doing campaigning work. Of course, our network as well includes all sorts of organisations that very much challenge from the outside, and other organisations that work within systems and with statutory services to effect change. Also, gathering experiences of people affected by these cuts and changes. We do that through supporting what we're calling member campaigns, so individuals that have particular issues that want to work with others and find out if other people are having those experiences. And what we do is work with individuals to look at how they can gather more information and then use that, and also potentially input into a more kind of national approach to communicating that campaign as well. Also, supporting individuals to get the right support to challenge decisions as well. So we don't provide individual advocacy, but we do support people to work through problems and to find out where to get the right support, and what organisations are the experts in terms of supporting their challenges. Also, presenting to our members, member groups on current issues, but also supporting local campaigns. Some of those include the Welfare Reform Action Group. North East Together is our affiliated network in the North East. So there are local campaigns and local initiatives and projects that we support in a variety of different ways. Next slide, Carrie. So making the policy of getting the right support at the right time and in the right place from the right person. This actually has been included within the 5-year forward view as a vision. It's a rather broad vision, but basically we facilitate collective responses to policy developments that help identify what is the right support, where people should access that support and who from. And we also communicate some of that information into the policy groups that we have positions on. So the 5-year forward view for mental health, the oversight and advisory group. This group was formed after the mental health task force group. Also Public Health England, the Mental Health Prevention Concordat, and CQC Mental Health Act Advisory Board. Our positions on these particular boards are as an organisation, and what we emphasise is that we are not the involvement. Our role at these types of boards at this level tends to be more advisory around wider involvement, as well as bringing the collective perspective to the table as well. We've already talked a little bit about this, but signposting people to and facilitating contact with relevant advocacy support and other local and user-led groups as well. So really connecting people with others that may be able to provide the right type of information, guidance and support. Also working with user-led groups to challenge local service cuts and changes that affect access and availability of support. So at the moment the Manchester User Network, MUN, have been making some very public challenges to local services about current cuts and proposed cuts, but also about the process of consultation as well. Next slide, Carrie. Thanks. So, number 3 is pressuring mental health services to make the principle of nothing about us without us a reality. This is really about being involved in decisions, in our own care at an individual level, but it's also about involvement at a community level, being involved in our community, but also being involved in service development and design as well at a strategic level. One of the ways that we have addressed this is a couple of years ago, it was actually 2012, more than a couple, but we secured some money from a voluntary sector grant to develop some involvement standards. This was what was to become the 4PI National Involvement Standards. And what many people had experienced over many years is that involvement tended to be quite challenging at times. The standard of involvement, the understanding of involvement tended to vary, and it was really how we could bring together everything that we'd learned, everything that we knew worked and what helped and what hindered involvement practice, and bring it together in one place and help to prevent similar kinds of challenges continuing to happen. It was also a way to address the loss of some really good practice, and we realised that when there was lots of restructuring within services and reconfiguration, quite often good involvement practice tended to be lost, and a lot of knowledge around what work tended to be lost. This now has become national. It's also in the mental health task force 5-year forward view. So there's lots of references to 4PI, and we've got over 60 organisations now signed up to the 4PI national standards, but we want to continue to work with the system partners to ensure that involvement practice, the quality of involvement practice, becomes more consistent across the board. Could you go to the next slide, please, Carrie? So working together with people from socially deprived and marginalised communities, again, we've worked quite hard over the last few years facilitating collective responses and quite often quick responses, and feeding those into policy developments. We've also challenged consultation and co-production practice that isn't inclusive, and also again supporting individual member campaigns to challenge more local practice when practice hasn't been inclusive and isn't involving the voices of a more diverse community. Also, we've facilitated focus groups for policy development, particularly for crisis care and Section 136, and also a more recent project around the physical health of people who've been diagnosed with a mental health condition, and some workshops more recently around women's mental health, housing and mental health as well. If you can have the next slide, please, Carrie. So challenging institutionalised discrimination and putting equality back on the agenda. Since, I don't know if people remember the AFIA Trust, and they hosted a BME service user network called Catch AFIA. And a couple of years ago, unfortunately, both of those ceased to exist. And since then, there hasn't really been a kind of national and collective voice for people from BME communities. We've supported some of that work, and we've facilitated a number of projects and studies around that. So one being the ethnic inequalities in mental health with Lankelly Chase. We've also challenged the perceived limitations to engaging with BME communities, which studies and different projects often refer to low response rates from particular communities in a way that describes as hard to reach. And again, we challenge that. It is about actually investing in resources and time to actually reach into those communities and work with people to ensure that the diverse experiences are included. Also working with Lankelly Chase again to strengthen the collective voice of people from different communities, but particularly mapping BME networks that exist across England as well, to ensure that informed people can connect and start to regroup around some of the top policy issues. Next slide, please, Carrie. Thank you. So point 6, call for reform of the Mental Health Act. As you probably all know, this has been in sort of the recent Queen's speech, and is also a political manifesto point for the Conservatives as well. We've been working with the British Institute of Human Rights. We've very much over the last couple of years increased our knowledge and confidence around human rights, and we tend to use the language of human rights now rather than of recovery. We feel that's a common language that we can all relate to, and it relates to all. We've also provided training to people and our members around human rights and the Mental Health Act, and we've recently been working with the Mental Health Alliance, although a recent survey we challenged the preliminary work because that wasn't as inclusive as we felt it should be. One of people who have experienced compulsion and have been subject to the Mental Health Act, but also people from BME communities. We've also we're also planning to lobby politicians and civil servants in advance of any work around the Mental Health Act reform, and we're also now a member of the Health and Wellbeing Alliance with the Department of Health. Point 7, Carrie. Thanks, slide 7. So reflecting the social model of disability and promoting informed choice and alternatives to medication. So again, we've facilitated a range of service user-led projects and studies, one of which was service users' experience of the care program approach, also Healthy Lives, which was around physical needs of people with mental health diagnosis. Also, we're working with like-minded organisations, so Shaping Our Lives, other user-led groups and activists. I think throughout everything we do challenge the dominance of the medical model, both in discourse and in practice. In all of the projects that we've run, people continually tell us the importance of other social determinants, but also other important things in their lives that actually affect well-being and mental health, as well as physical health. The individual member campaigns, I'll just mention a few of those. We've had people working with us that have wanted to pursue their own particular issues. Some of those have been around control and restraint, physical and psychological. We've also worked with a young man who had experience of gang crime and the effects of that, but also some of the support that actually helped his journey into recovery. We've also run a number of user-led pilot projects and leadership programs, which I've previously mentioned. Some of the pilot projects then lead on to further work that we can scale up and actually share with other members as well. And finally, number 8, so I'm rushing through that a little bit because I'm just aware of the time, but I'm going to hand back to Emma just to talk about the Reclaim Challenge and Revive Survivor Knowledge and Research.
Lovely, thank you. Yes, so the Survivor Researcher Network, that was a network that was set up to support people with lived experience of mental distress who are engaged in or interested in research. And that was hosted by the Mental Health Foundation until 2001 when it moved to NSUN. And in 2013, following survey of the SRM members, we relaunched the network. And that survey provided us with a better understanding of people's interests and skills in user survivor research. And it's also helped to formulate draft aims and objectives with a potential for the new research network. So I'll just take you through the aim and objectives on the next slide, if that's okay. Thanks. So the overall aim of the network then is to provide mental health service users and survivors involved, interested in research, a forum for networking, sharing information and supporting each other. The objectives to act as a hub for resources, information, opportunities and support, work on a peer support model in collaboration and partnership, promote the importance of concepts and evidence based on lived experience as fundamental to the knowledge base on mental health, human rights and social justice, and campaign to rebalance the hierarchy of evidence currently existing in mental health research, so that the quantitative methods, randomized control trials. So we're looking, again, I've talked a lot about the qualitative methodology, so it's about kind of rebalancing that hierarchy. And influence mental health policy and practice through user survivor-led research, increase the capacity, skills and knowledge of survivor researchers through mutual support, mentoring, and wherever possible, training and learning opportunities. So we have about 250 members of the SRN now, and some of those people are working in universities in academic positions. There are some people who might want to be involved in research, but they're not working in a professional capacity. They want to find out more about it. And then finally, working from a value base of inclusion, acknowledging the diversity of experiences, identities and backgrounds of survivor researchers. So if we can go to the next slide. Lovely, thank you. So in July 2016, members of the SRN met for a seminar, Reclaiming, Challenging and Reviving Survivor Research. So we set up an event working group to look for funding for that, that came through SRC, and also some funding from Middlesex University just for that event. And on the day we were looking at questions within each of those three main categories: reclaiming, reviving and challenging survivor knowledge. So under reclaiming, we were asking, how do we address the issues rising from co-option of service user research into public and patient involvement by the NHS, academia and large corporate mental health charities? In the reviving section, we were asking, how do we address the broader social issues of marginalisation, oppression, inequality and impoverishment, and question the relationship between deepening inequalities and mental health? And then challenging survivor knowledge, looking at ourselves, how do we critically examine survivor research and knowledge itself, when much of the known history of the movement is white and heteronormative, so very straight as well. So we had some really interesting speakers on the day speaking from their own perspectives. I don't have time to go into that at the moment, but there is a report that we've written that is on our website, and I've also written a blog about the event for sociological review. So if you're interested to find out more about what was discussed, do follow that up there. In terms of our latest work, we've got a new working group that we've just established to take forward the work of the SRN. We've just had our first meeting a couple of weeks ago, and so so we're looking to develop the work that way as well. So yeah, we can move to questions, I think, and feedback.
Thank you both. Sorry, there seems to be a bit of a lag between me clicking them and them actually changing on your screen. So I'm sorry about that if that seemed really slow and turgid at times. I can see already we've got a question from Angela Warren. Now, Angela, I'm going to try and unmute you so you can ask this question yourself. I don't know whether if you're in a noisy office or whatever, or if you've got a microphone. We'll give that a go, and if not, I'll read it out. So I'm going to click unmute now. Angela, can you hear us?
Yes.
Fantastic. Do you want to ask the question directly?
Okay, yes, it was from one of the slides about socially deprived and marginalised communities. I wondered how you reach those people, and a discussion that we've had recently here at Bournemouth University is how do we identify who marginalised people are in the first place? So it's kind of a two-part question, really.
Hi Angela, it's Sarah here. I'll hand over to Emma afterwards. I think in reaching our membership and our communities, I think it's about kind of the grassroots. And many of our member groups have really come about through need, because they haven't been able to get the support they've needed. They've had disadvantage in a number of ways, and so have come together to address that disadvantage. And I guess the network was established to really create connection and help connect with some of those groups and individuals that are often termed as under the radar. So it's really reaching into existing networks, but then almost networks beneath those networks that we are aware of, or more usually aware of, and then working really closely with them. I think it's really about developing trust as well. I don't think we can always make decisions about who are most socially deprived and disadvantaged, but I think there are definitely places and people to go to, and that's why I think I did refer to in the slides before how often people not being able to make contact with certain groups will say that they're hard to reach. Actually, we just need to make a little bit more effort to reach into those communities. I don't know if Emma, you want to say anything else?
Yes, I mean the first set, I'd agree with everything Sarah said there. The thing that springs to my mind is obviously access to technology and social media. So obviously we put out a weekly e-bulletin, Facebook and Twitter presence. But I think for people who who aren't on email, who wouldn't feel comfortable using computers, I think that's where the kind of the direct regional kind of contacts come in. So so for example, I live in Leamington, and so some of the work that I do in the area is kind of making communication and kind of links with groups in West Midlands area. So one of the things that I do is keep in contact with the people who are coordinating groups and sharing the information with them. So from our bulletin, or if we've got the members survey, and so that's then passed on within meetings. So people are discussing that, so they're connected to NSUN. They're hearing about us, even though they aren't directly on social media, for example. But yeah, I think your question is really interesting, kind of in terms of who decides who's marginalised, and so very often it's it's the people who are in power saying, oh yeah, that group over there, they're marginalised and we need to get out and reach them. And I think it's kind of thinking a bit more broadly and kind of creatively, and yeah, and linking back to what Sarah said really about grassroots. Okay.
Yeah.
Does that answer the question for you, Angela?
Yes, I think so. Thank you. It's just that we've had a lot of conversations recently about phrases like seldom heard voices, and how do we reach them, who they are, and you talked about the networks that are already existing, but it's beyond those networks, isn't it? It's the people that don't come to meetings, it's people that don't access social media. It's kind of finding where they are and what their issues are and what they what's important to them as well, which it can be a challenge, can't it? But it's important to find those voices.
Absolutely, yeah.
Just to quickly add that it's actually also really helpful to sometimes go to some of the charitable trusts, like equivalent of Trust for London, but Lankelly Chase, who will be funding some of those groups that have links with some of those other sort of individuals that aren't accessing involvement opportunities and particular group activities and things like that.
Yes, yeah, thank you.
Thank you. Angela, I'm going to mute you again now so that I can see there's another question. Is that okay? Are you happy for me to do that now?
Yeah, that's fine.
Yeah.
Thank you very much.
Okay. The next question is from Sue Rees. Now, Sue, I've just tried to unmute you, but I think you're on the phone, so that's not going to be possible. So I'm going to read your question out, if I can find what I've just done with it. I have a really busy screen on here that gives me a huge amount of information, so I've just got to try and kind of find where. There it is. So the question was, what work is NSUN doing around the environmental and other external determinants that impact on our mental health?
Right. I guess, crikey, that's a big question. Interestingly, we have just updated our ethical policy, so that's actually helped us think about some of those wider kind of issues and impacts that the environment can bring to our mental well-being. So we've talked about obviously the kind of, you know, the work that we may do with other organisations and the work that we may not do. We talk about efficiencies, we talk about all sorts of things and approaches, so I'm happy to share that. I think, you know, socially, around housing, I think we've heard the term holistic for many years, but it's really thinking about what that means to us and all the things that actually help our well-being, you know, having something to do, having someone to do it with, being safe, being secure, which of course at this time and with the political environment, people are really, really concerned about. That it's all the things that we know or we need to find out about how we can be as healthy as possible, but support others to be as healthy as possible. And I guess when I think about environment, I think about our sort of carbon footprint as well. So you know, some of the obvious things around how we run as an organisation and what we do, how we run events, how we run our business. I think we've been pretty lean and efficient over the last couple of years, particularly because of resources, but because of awareness about, you know, good practice and how we need to, yeah, run our own business and support others. I don't know if that answers the question. Emma, have you got anything to add to that?
No, just to add into the point about the holistic methods, we've got a very new member campaign that we're in the process of developing at the moment, which is looking at alternatives and holistic models of mental health care. So I think there's potential within that work as well to kind of take some of that work forward. Yeah.
That sounds really interesting, and now you've thrown that out there, Emma, I'm thinking that might be something to come back and talk to us about in a future webinar, because I think that's a really big topic, and there's so much, you know, there was the all-party parliamentary report last week into the impacts of arts and on well-being. There's so much stuff out there, isn't there, that we could draw on and learn from. Yeah. I think that's all the questions that have been raised. A couple of very, very practical things. How do people become members? Is there a cost to people? I'm sure this is all on the website, but I'm just thinking while we're here, it's worth asking. And have you got different levels of membership in terms of, you know, a whole group can be a member, and then individuals in their own right as well?
Yeah. The easiest way is to go on the website, and you can join via the website. It's free to individuals and user-led groups. We're just looking actually at implementing a charging policy for our ally members. So they are non-user-led groups, and there's a sliding scale, as there are for most membership type of organisations, depending on the size of that organisation. And what we have provided, I think for quite a few years now, is a free service for people to advertise opportunities and events and their news in our communications. So yeah, we're looking at how we actually continue to resource that. But also you can just phone us or, you know, email us and we can sign you up.
Fantastic. I think that takes us to 1 minute to 11. I've just had a comment in from Sue, who's who just raised the question, saying thank you for the response. I found the webinar most useful, which is really great. Thank you for that comment. Hope everybody else that's been listening has done too. Emma, I wanted to say thank you particularly for explaining post-structuralism in about 90 seconds, because when I'd seen that in the slides, I started to get a bit anxious about whether I'd understand, and I did, so that fantastic. Thank you for doing that, and just really useful to go through step by step each of those things and know that this is a developing document, a live thing, isn't it, and that people can continue to kind of influence that and see its evolution. So we'll keep, I'm sure, with the Association of Mental Health Providers and our partnership with NSUN. Yes,
sorry, can I just interrupt? Just to say that if anyone's interested in joining the Survivor Researcher Network as well, my email is on one of the slides, so do get in touch with me, and then I will add you to that mailing list as well if you're interested. So.
Yeah, I was going to come to that and say I think that's a fantastic, it's great to see that that's back. It made me make a note to myself, because back in 2000 I chaired what was then the first National Survivor User Worker Conference in Manchester, the first coming together of a group of people who nationally who were all working in the field, who had lived experience, and it kind of made me think about the kind of journey we've been on in that time, really. So fantastic that that's got such a kind of strong and powerful membership. So really look forward to hearing more about that. So thank you both very, very much for your time this morning. I know doing a webinar is such an odd thing, sat in a room talking to yourself with some headphones on. So really appreciate you doing that. We've recorded this webinar. We'll be sharing it around. I think Daniel will probably be sending it out over the next day or so. Oh, another question's just popped in. If we've got a minute to answer it, which is just slightly over, but we should be okay. Hilary Dixon's just said, social housing blocks of flats which lump together mental health patients along with drug addicts and alcoholics is deadly. So I think that's a really good point, Hilary. And we have got, which actually segues me nicely to some future webinars coming up. Advance Housing are going to do a webinar for us in September probably around shared ownership and the experience of working particularly people with lived experience of mental health, to develop shared ownership schemes so people can live in their own properties and not live in some of the kind of shared housing scenarios and social housing that perhaps they wouldn't ordinarily choose. So that might be one, Hilary, that you'd perhaps be interested in the future. I think on that note, thank you both again. Thank you everybody for joining us. Hope you've enjoyed this morning's webinar, and we'll be back in September with a series of new webinars. I was going to say have a great summer. I'm looking out the window in Manchester and it's pouring down. So it's fairly typical. Thank you all very much. And good morning.
Bye.